Okay. Um, Good afternoon, everybody. Welcome on our fourth webinar as a part of our 30th anniversary of Lucas, KU Leuven, Lucas, the Center for Care Research and Consultancy. This is the fourth seminar in a row, and it's part of our focus on implementation research. And as you probably know, as our research center is very much specialized in doing practice-oriented and policy-oriented research. These webinars are made possible by the Prof Chair, and Prof state means the patient room of the future. In this fourth seminar, I will deal with the issue of the fight against homelessness. I will focus on some lessons learned and insights based on my current research, which is very much influenced by the paradigm of implementation research. Firstly, let's go back to some insights from the earlier webinars. In these earlier webinars, we already gave a presentation on the meaning of implementation research. Implementation research is the scientific study of implementation processes and strategies to promote the uptake of evidence-based practices into routine care and policy. This definition is coming from the implementation science literature, which is growing and growing during the last years. The objectives of implementation research is to identify implementation problems, to develop and test new solutions to these problems, and also to identify how these evidence-based practices should be modified to achieve an impact in real-life settings, and also to identify optimal approaches for a particular setting. Implementation research and implementation science has been growing during the last years, mainly as a solution to much real-world problems, and these real-world problems are related to implementing specific evidence-based programs in real-life settings. If you are doing implementation research, you have to take into account some specific characteristics of this paradigm or this approach. It is demand-driven. It is contextual. It pays attention to the specific contexts. It's complex, it's multi-level, it's in a real-world context, it's systematic, you can also see it's multidisciplinary, it's interdisciplinary, it's multi-method, and it's participatory. A lot of different characteristics which you have to keep into account when doing this kind of implementation research. Implementation research is mainly developed in the context of health sciences, but it's also used in other fields such as educational research, research into criminal justice and other social fields. As I mentioned earlier, implementation science is rather new, but at the same time, we know a very long tradition of evaluation research, and this evaluation research is based on various scientific paradigms. You have evaluation research which is founded more on a positivistic approach, while others make use of more constructive and constructivism as a guiding paradigm. In my webinar today, I will make use of what's called the realist evaluation, and sometimes the realist evaluation is called a third way of doing evaluation research. It's not constructive, it's not positivistic, it's realist. And this means that we focus on a very specific research question, and we call this, or we state this as a realist evaluation research focuses on what works, for whom, in what respects, to what extent, in what contexts, and how. And it's much broader than a narrow positivistic approach which mainly focuses on what works. It's not only on what works, but also it's about target groups. It's also about how it works, what makes it work, in what contexts does it work, and how does it work specifically. And more in general, realist evaluation wants to identify the underlying mechanisms that explain how it works, how the outcomes were caused, and also focuses a lot of their attention to the specific characteristics of context. This realist evaluation approach is not new. It was already developed by Pawson and Tilley more than 20 years ago, in 1997, in their groundbreaking book on realist evaluation. And it's very interesting to see that in health sciences we are developing that implementation science, but at the same time in other fields we have already a long tradition of doing evaluation research, and I think we need to bring both worlds into contact with each other. And I'm not the only one who is saying this. During the last years, we see more and more articles and papers in, for instance, implementation science, which try to link this paradigm of realist evaluation with implementation science. Realist evaluation, as I mentioned earlier, focuses on the mechanisms. It's about what makes it work. It's about the theory of change underlying intervention. And it also focuses on the specific characteristics of context. We know from studies, but we also know from experience, that in some contexts, some organizational contexts, some policy contexts, some programs work better or even don't work compared to other contexts. So context is very much important. And in a lot of studies, and especially in randomized controlled trial studies, this context is not focused on. The context is almost neglected, while this context plays an important role. Ray Pawson, like I said earlier, is one of the founding fathers of this realist approach. And in his book in 2006, he tries to define specific characteristics of interventions, of programs, and these three characteristics are very much important if you are doing realist evaluation. And the first one is that, like I said earlier, programs are embedded. Programs, interventions, methods are always inserted into pre-existing social situations. So this also means that this situation plays a role in the way these new interventions are developed and implemented. Programs are active. This means that they are active in the sense that their intended effects work through the reasoning and volition of their subjects. In other words, programs only work because actors, persons, organizations are implementing them. So, for instance, and I give a lot of examples about Housing First later on, Housing First as a method, as an intervention for homelessness, works not as an intervention, but it's because people make this intervention work. So you have to pay a lot of attention to how these actors, professionals, practitioners are implementing these interventions. And thirdly, programs are theories. Interventions, methods are theories. This means that they are always based on a hypothesis about how it works. Why are we doing things? Because we think that if we do this, it causes specific things. So we have an underlying theory about how it works specifically. And instead of focusing on what we are doing, we also have to pay attention on how it works, what makes it work, what is the underlying theory that makes it work. Realist evaluation and realist approach is a growing paradigm in evaluation research. It's been taken up in different fields in health sciences, but also in social work practice. And these are three books which I think are very interesting if you want to base your work on a realist approach. The left one is the Evidence-Based Policy book by Ray Pawson in 2006. In the middle is a very recent book from last year. It's called Doing Realist Research, with a lot of different chapters by Emil, Greengal, Anna Manzano, and others. And in this book, they developed the methodology of realist approach. There are chapters, for instance, how you do a realist interview. There are chapters on that concept of mechanism. And on the right, and this is for me a very influential book, it's the book by Björn Blom. He's a Swedish social work researcher, The book is called The Theory for Social Work Practice, and in this book he develops or he applies a realist evaluation and critical realism to the study of social work practices. And in that book, he uses the Keimer framework, and the Keimer framework is a guiding framework if you want to study social interventions and the implementation of social interventions. It's quite complex. I'm not going into detail on all the boxes, but what's more important, Keimer states, or Keimer means contexts, actors, interventions, mechanisms, and outcomes. And you see how the realist approach influences the way Bjorn Blom does implementation research. You see the concepts of context, actors, and mechanisms coming back. So in general, what adds realist evaluation to implementation science, it focuses on mechanisms. It focuses on the question, what makes it work? What is the underlying theory of change that causes these changes? Realist evaluation is also interesting because it permits to develop interventions bottom-up. It helps practitioners, organizations, to identify mechanisms and the way context influences the implementation. It is very interesting, I think, from my perspective, to identify the underlying mechanisms and context together with stakeholders. So realist evaluation is participatory. It pays a lot of attention to the perspectives of different stakeholders, including the target group, social work users. And from my perspective, I think realist evaluation is very useful when new social problems evolve. For instance, the example of radicalization, which is a very new social problem. We want to develop new approaches. We don't always have the time to have big studies to see how it works, what works, but at the same time, these practitioners have to act. And then realist evaluation is a very interesting approach because it helps you to identify the mechanisms and contexts from a bottom-up. So this is the general framework which I use doing implementation research. It's on context, it's on mechanisms, and from my perspective, I think realist evaluation is very much needed in this growing field of implementation research. This is the more theoretical approach. Now let's go to homelessness, and let's go to some specific examples to show the value of evaluation research and of realist evaluation. Let's say something first on homelessness. This picture or this graph is coming from Fianza, and it shows that homelessness in Europe is growing. If you look more into detail, you see all those red lights, and all those red lights show that homelessness is on the rise throughout Europe. There's one exception in the north of Europe. It's Finland. And Finland is the only country in Europe which succeeds to diminish homelessness in their country. And it's mainly caused by the fact that compared to the other countries, Finland is the country which invests the most in housing first. Finland is the only country in Europe which has a nationwide implementation of the housing first paradigm. Throughout Europe, you see that homelessness is on the rise. But if you go much more into detail in this graph, you will see that there are numbers, but all these numbers mean different things. And it has to do with the fact that we don't have a common methodology to measure homelessness in Europe. All these different countries are doing different things, measuring different things in different ways. And I give another example. This is a table coming from OECD, the housing database. We all knew that OECD is a very important international institution producing statistics. And they not only produce statistics, but they also develop common methodologies to produce statistics. And if you look more into detail in this table, you will see a lot of different numbers. Number of homeless people, you see the lot. For instance, Czech Republic, 68,000 people. Mexico, 40,000. But you also see Estonia, only 864. And we all know that these kind of big differences causes a lot of questions. And it all has to do with the definition of homelessness. In all these different countries, different legal definitions are used to define homelessness. Different categories are measured. So if you go back to the last slide, you all see these red lights, but you can't compare these data because all these red lights are pointing to different target groups at different definitions of homelessness. So, of course, if you want to diminish homelessness, we first have to agree on what we mean by homelessness. And secondly, we also have to find a consensus on how to fight against homelessness. Some of the students in this room will know that I state a lot that how we define the problem influences the way we are going to solve it. If we define homelessness as a care issue, then we will say we need more care. If the problem is that people have psychiatric or substance abuse problems, and is this causing homelessness, then we will say the solution is more care. If we say that homelessness is a housing problem, then we will develop completely different interventions. We will develop more housing opportunities for homeless people. But if we define homelessness as a poverty issue, as a problem of a lack of income, then we will also develop other interventions. And the way we define the problem, like I said, influences the intervention. And of course, here you see a first example of this realistic evaluation approach that I use. How do we define it? What are we think is the main problem of homeless people? What is the definition? And how do we think that we can solve the problem? Here you see a first example of how the theory of change and makes us think about solutions. In the past and in a lot of different countries, for instance, the Netherlands, you will see that they define homelessness as a care problem. They talk about care avoiders, and what we need is more specialized care problems, cure problems, focusing on the psychiatric and addiction problems of homeless people. In Finland, you see the completely opposite approach. They say homelessness is a housing problem, and we need more housing opportunities, so that's why they have implemented this big Housing First program. So it's all depending on how we define the problem. And what we see now throughout Europe is that we are experiencing what I call a paradigmatic switch to a housing-led approach. More and more it's believed that housing is the best solution for homelessness. It seems quite simple, but from a practitioner point of view, this is still very difficult to understand. It's very strange that it's not accepted that homelessness is a housing problem. Even nowadays, it remains very difficult to define homelessness as a housing problem. Although we had a very big conference in 2010. It's called the European Consensus Conference. It was a very big conference in Brussels. And in that conference, it is stated that the jury calls for a shift from using shelters and transitional accommodation as the predominant solution to homelessness towards housing-led approaches. And this means increasing access to permanent housing, not temporary housing, and increasing the capacity for both prevention and the provision of adequate floating support to people in housing on the basis of need. And you will see later on in this jury report that they will also plea for housing first as an important solution for homelessness. This was a very big conference in which all different actors, policy actors, stakeholders, civil society organizations came together to define a consensus on how to go on with the fight against homelessness. And although there was a very big consensus that housing-led approaches are the main way of dealing with homelessness, at the same time, and we see that scaling up housing first and scaling up housing-led approaches remains very difficult throughout the whole of Europe, with the exception, of course, of Finland. What is housing first about? And you will see that going through this presentation, I will make a distinction between housing-led approaches and housing first. Why is this important? Because housing first is a very much standardized intervention. It's protocolized. We have a very clear protocol how to implement housing first. What are the common characteristics of this housing first approach? Housing is the first solution to homelessness. If people are living on the streets, then the first thing we have to do is getting them into permanent, not temporary, and permanent housing. This is the first. The second characteristic is that this housing opportunity is unconditional. So this means that we decouple housing and treatment and care. The support given by professionals is decoupled from the housing. So this means that homeless people staying in this kind of housing first project decide themselves if they want help or not. This is a very essential characteristic, and it's linked with the autonomy approach of housing first. Housing first is very much based on the idea that homeless people are very much capable of making their own choices. So this also means that homeless people can decide themselves if they want to have support or not. And so this decoupling is a very essential ingredient of the housing first approach. Thirdly, housing first is based on the idea of harm reduction, and it's based on the theory on rehabilitation as guiding theory of change. The harm reduction approach is maybe you are familiar with it. It states that in case of severe addiction problems, for instance, alcohol abuse, drugs abuse, even then, it's not getting people get rid of this addiction. No, it's trying to reduce harm. If people want to use, it's their own choice, and we want to have not the negative effects of this addiction. So this means we try to reduce harm, and that's all. We don't want to get people rid of addiction. And this is another very essential characteristic. But at the same time, in a lot of professional contexts, this remains a very difficult thing to do. The target group are homeless persons, very broadly defined, and we have a very strong evidence base on this program. And this is one of the biggest studies on housing first that has been done in Canada. It's called the Chez Soi study. It's a randomized controlled trial in 5 cities, 2,000 participants with a control group and an intervention group. This is very convincing evidence. On the left, you see the total amount. The blue is the treatment as usual, and the green one is the intervention group. And what you see is that the housing stability in the housing first model, the green light, is much more stronger than the treatment as usual. And that's the left one, and the right one table, you see the quality of life, and the difference is not as big between treatment as usual and housing first, but housing first scores better with regard to the quality of life. So you have more housing stability, much more housing stability if you are using housing first. And in addition, the quality of life of these people is much more better. And maybe a more important issue also, it's not in the table, but housing first is also much more cheaper than treatment as usual. It seems very strange to believe that if you support people by giving them housing, that it's more cheaper. In practice, it is, because when people are living on the streets, when people making use of residential services, they come in contact with the police, they're stealing things, they're getting in the emergency room of the hospital. All these different things cost a lot of money. And especially if people are living on the streets, they cost these kind of costs a lot. So housing first, in the end, it's even cheaper than doing nothing. It sounds very strange, but it is the case. So it's very convincing. This is a very big study, 2,000 participants, a very strong methodology based on randomized controlled trials, 5 big cities, 5 different contexts. So why don't we do it? If it's so convincing, if it costs, if it's cheaper, and it's more effective, why don't we do it? And some will say, yeah, but this is Canada, and in Canada it's a different context. That's not true. We had our first Belgian Housing First study, also based on a randomized controlled trial. On the left hand, you see the results of the Housing First group after 2 years, and on the right, you see the care as usual, the treatment as usual. And you will see that after 2 years, 90% of people in these Housing First projects are still living in their house. And it's much more convincing than the traditional approach. And the traditional approach, after 2 years, only 48% of the people in the control group are in a stable housing. So we also have a very strong Belgian evidence on the effectiveness of Housing First. When these projects started in 2012, it was very much believed that these projects won't work. There were a lot of assumptions about the target group, and the bottom line of these assumptions were that these kind of people are not able to live alone, to live stable. That's not possible. They are addicted, they have severe psychiatric problems, they are not capable to live alone. That's not the case. The Chez study in Canada shows that they are capable in doing it, but also the Belgian study has very strong evidence. Some say there is a Hawthorne effect. I'm not sure you're aware of what that is, but the Hawthorne effect means that if you're in a study, you probably are going to do better than compared to when you're not in the study. If you are like, if there is a camera on you, you will act probably differently than when it's not the case. But even though there is some kind of a Hawthorne effect, maybe we don't know, it's not studied, but even then, the results are very promising. So we have very convincing evidence in Canada, but also in the United States, in Finland, and also in Belgium. So why don't we do it? Why is it so difficult to scale up Housing First to a nationwide approach? Like I mentioned earlier, Finland is the world leader, but there's a very slow adoption in many countries. We have a very specific protocolized way of doing Housing First. There is a fidelity scale developed by the Canadian study. This fidelity scale shows what you have to do when doing Housing First. But in practice, what you see is what I call a proliferation of Housing First models. We're doing a little bit of Housing First. Yes, we are influenced by Housing First, but we rate by giving housing opportunities, or we are influenced by Housing First, but that harm reduction model, we are not convinced of that. So what you see in practice is they are not doing what they have to do based on the standardized manual of Housing First. And also in Flanders, since 2015, we have 300 homeless people in Housing First projects throughout Belgium, mainly in the big cities, but only in the big cities in Flanders. But still, we have more than 1,000 beds in residential services, and a residential bed costs about 50,000 euros a year. So this means that we are paying almost 5 million, 50,000, 500, 50 million euros a year to pay all these different beds. So beds are very expensive. Housing First is less expensive, but at the same time, if you look to these numbers, even we have very convincing evidence, even we have some Housing First projects in Flanders who have good results. Scaling up the intervention to a national approach remains very difficult. And then, of course, implementation research becomes important. Why is this the case? Why don't we do it more in Flanders, but also in other countries? How is it possible that this very promising approach, this evidence-based approach, is not been taken up and practiced more than it is now? And it all has to do, and then I come back to that realist evaluation approach, it all has to do with context, with actors, with mechanisms, and with policies. And these are the guiding concepts of the realist approach. Context, who is the target group here in Belgium? Who are homeless people and at the moment? And maybe the target group is changing, and this also means that we don't need Housing First. We don't know. I come back to that. What do we know about the actors? How do Flemish, Belgian residential services consider Housing First? Is it a new intervention or is it a new paradigm? This is, of course, very different. It's a new intervention. This means we do something new, but at the same time, we keep doing the things we have done in the past. And we add something. We see that we have 300 Housing First project, but at the same time, we have 1,200 beds. We don't diminish those kind of beds. It's a new intervention. We add it to our current reality, but we don't use it as a new paradigm. We don't stop the other things. What do we know about the mechanisms? And this is a very important one. To what extent is the decoupling of housing and treatment and care possible in Flanders? A lot of these Housing First programs make use of social housing opportunities, and a lot of these social housing actors are not convinced that the decoupling will work. If you want to get in a house by a social housing company, they will ask you, or they will make this housing conditional, and this means that they only accept you if you accept also the treatment, also if you also accept the social support. So this decoupling is almost impossible in Flanders. So this says something about the belief in these kind of mechanisms. And of course, on the policy level, what is very counterproductive, that is the fact that we have very long waiting lists in social housing. At this moment, more than 120,000 people are on the waiting list for social housing. And of course, that leads to a lot of competition between all those vulnerable groups. All those vulnerable groups want to have their social housing. So it only works if you have a policy which invests in these kind of projects. If we use these concepts of context, actors, mechanisms, and policies, it helps us to identify the answers to the question of why don't we scale up Housing First in Flanders. If we look to context, Housing First was already developed in the mid-90s in the United States. It was developed by some Semberes, and it was mainly developed as an answer to the growing group of people with severe psychiatric or addiction problems. But I showed you the numbers earlier on. What we see throughout Europe is a growing number of homeless people, almost 700,000. It is estimated 700,000 homeless people throughout Europe. We don't only have an increase, but what we also see is that we have changes in the profile of homelessness. What we see is a growing amount of family homelessness, and what we also see is a growing amount of youth homelessness, migrant homelessness, female homelessness also, but I mainly want to focus on the family and the youth homelessness because this asks us to ask the question, is Housing First still the good model? Is Housing First a one-size-fits-all model? Does Housing First work for families? We don't know. If you look to the CSWA study, if you look to the Belgian Housing First study, these are mainly adults who are alone. So we don't have that convincing evidence for families. What do we do if children are involved? Is this harm reduction approach still possible and still feasible if there are children? We don't know. So if the profile is changing of homeless people, then we still have to think, is Housing First a good model? And we also see it in an American study. It's published recently. It's another very big study. More than 2,282 families in residential and crisis centers have been followed 3 years. They have split up these 2,200 families in 4 groups. They had a group with a subsidy only. These families received a permanent housing subsidy for 3 years with no services, so a deep coupling of services and money. There was a second group, a project-based transitional housing. It's a temporary housing opportunity. Families could stay 2 years in this housing opportunity, and they will also offer a very intensive package of supportive services. It's quite comparable with what we have in Flanders, that temporary begeleid zelfstandig wonen, temporary housing, which is realized by the CAW's. Then you had a third group, which was called the community-based rapid rehousing. This is a little bit comparable with Group 1. The big difference is that in Group 3, these families only got rental assistance, a housing subsidy for up to 18 months, while in the first group it was throughout the whole program. And then the fourth group was the usual care. So these were a little bit comparable with the housing, the treatment as usual group in Housing First. So they didn't do any additionally to these families. Why do I use this example? Well, I want to show that Housing First is not a solution for all problems. Although I'm very much in favor of Housing First, if the context is changing, if the target group is changing, then we have to look for new solutions. And what does this study show? This study shows that in case of families, homeless families, the best solution for them is giving them a permanent housing subsidy. The families in the first condition, let's go back to the slide, in the subsidy-only condition, had the best housing stability situation, so they were housed stable as long compared to the other groups. But what is more interesting, the mental health of these parents was much better than in the 3 other conditions. And in addition, the children went more to school than in the other 3 conditions or in the other 3 groups. And what's even more interesting, we also see that this intervention, the first group, is not the cheapest, but almost the cheapest. This intervention costs about $1,127.72 a year, while the treatment as usual, the usual care, costs almost 5,000 euros. But also the temporary housing program costs a lot more, $2,706 dollars. So this shows that giving families housing subsidies is much more effective than getting them into temporary housing. And still, also in Flanders, what do we do when we have homeless families? Mainly, we choose this solution. And this solution is more expensive and has less good results with regard to school attendance and with regard to mental health of the parents. So once again, we need new studies. And We can't make the fault then saying, yeah, but housing first is the best model for everyone. It's not. We have to pay attention to the target group. The same applies to youth. We have at this moment an ongoing project on does housing first work for youth? There's still a very strong ongoing scientific debate on that. There is less evidence available. And at the moment we are in a project supporting a youth care organization in Flanders. And this youth care organization wants to develop the housing first approach for these young people. And last year we did a literature review on housing first for youth. And what's interesting, the youth care organization is very much in favor of this housing first, but at the same time says, yeah, we have also a lot of youngsters between 18 and 25 who have been in prison. And thus, housing first for youth also work for youth who come from prison. So what we did is we did a literature review on housing first for youth. And together with the organization, we also did a literature review on how to avoid reoffending of youngsters. How do we, what kind of intervention work if we do, if young people come out of prison? And it's very interesting to see that these are two completely different fields. On the one hand, you have studies on housing first. They don't say anything about reoffending. And then you have a lot of studies on interventions to avoid reoffending. And they don't say anything about housing. And the housing first model for youth, we have some evidence, states that it's all about choice. It's all about autonomy. Even young people have to make their own choices. If we go into detail into the studies on reoffending, we see completely the opposite. It's very much based on a behavioral approach. It's quite directive. It's about making the right choices and nudging young people that they make the right choices. So, youth care organization asked me, what do we have to do? To what kind of literature and evidence do we have to look? Do we have to look to the evidence on housing first for youth? Or do we have to look on the housing first, on the literature on avoiding reoffending? And this makes it interesting. This is why the actors are very important also to take into account. This was a very interesting point raised by them. It's quite simple. What they say is we have a very diverse target group, and if we go into the evidence, if we go to the scientific research, we don't find the right answers. So what we are doing now at this very moment, and it will be next year also, we are going to do some experiments combining the insights from housing first models for youth with these models which try to avoid reoffending. And it's experimenting bottom-up development of this kind of interventions. Why? Because we don't find the answers in the literature. At this moment, we're also evaluating a small-scale housing program for care leavers. It has been developed by the Flemish government. And what we are doing in that program is focusing on the mechanisms, what makes it work, but not only from the perspective of the practitioners, but also from the perspective of the youngsters themselves. Like I mentioned earlier, implementation research has to be participatory, so we're going into the question, what makes it work for you as a young person in this model? And we often see that the mechanisms as defined by the practitioners are completely different from the mechanisms as defined by the young people themselves. So combining both insights is very much important if you want to study the effectiveness. If we go into detail on the actors and the mechanisms, if we discuss housing first, and I've been doing a lot of focus groups with practitioners on that, if I discuss with them housing first, they're all in favor of housing first. They say we need it, but it is an alternative. It is part of a broad, varied supply of services. We don't want to stop things. We want to add a little bit, but we don't want to stop these residential services. We don't want to stop these temporary transitional housing programs. No, we want housing first, but as one of the different interventions we will use. So there's a lot of, yeah, we need that housing-led approach, yes, but, so there's always a but in it. There's always some reasons why we don't want to scale it up. So training these professionals is very much important. Like I mentioned earlier, if we go into detail to the mechanisms behind housing first, you will see that decoupling of housing and support is not much. There's not much support for that. Last year there was a very big conference with more than 300 people on the future of psychiatric services in Flanders. And in the beginning, they asked me to give a lecture on housing first. They were very much in favor on housing first, until they heard the details of housing first, and more specifically, that decoupling of housing and support. And at the end of the lecture, I was quite convinced that nobody was with me anymore, because they were saying, but we can't do that. That decoupling, we can't do that. These people are not capable to do that. So that choice is such an important issue. And in the end, if you see that there's not much belief in that mechanism. You also see the same in the current Flemish government agreement. There's one sentence in the current Flemish government agreement on homelessness. And what's interesting, even housing first is mentioned in the agreement. So it states that we want to support the housing first model, but there's a second part in the sentence, it needs to be coupled with support. So that's very interesting to see that although the Flemish government wants to invest in housing first, the main mechanism behind housing first, namely decoupling of housing and support, is neglected, and it's in the Flemish agreement. So I'm not convinced that there will be more housing first in the following years, and it all has to do with the belief of a lot of practitioners and policymakers that these people are not capable to live alone, to have their own stable housing. And we see it so it's so even funny, it's not the right word, but it's so funny to see that in such a general government agreement, that detail is mentioned. And so we are not against housing first, but so we always see the same thing coming back. And they also are. There's also a part on Skivehuizen. Maybe you're familiar with that. It's a specific intervention coming from Denmark. And they say it can be an alternative for housing first. So we see once again the idea that we need a varied approach to the fight against homelessness. And also harm reduction that's not feasible, especially, for instance, in Antwerp. There's a lot of critique by the local policymakers about harm reduction, and some practitioners are telling me that they can't talk about harm reduction anymore because it's not supported by the local government. Okay, let's try to make some conclusions on implementation research, homelessness, and housing first. The first thing is, I think we have to avoid the risk of assumptive research. And this means that assumptive research is research that's based on a lot of assumptions which are not true. And even a lot of research on homelessness is assumptive. And I mean by that a lot of research thinks what homelessness is and how we can define it. And that's of course not the case. Homelessness is a social problem, and typical for a social problem is that it's not stable. It's changing throughout the years, and we see it in the numbers, and we see it in the profiles. Housing First was developed in the beginning of the 90s for a specific target group, and if we look nowadays to the problems on the streets and the homelessness statistics, we see a lot of different target groups popping up. We see homeless families, we see homeless youth, and we are not sure that these models also work, or Housing First also works for them. And I showed that very promising a family option study in the United States, which shows that rental subsidies is a much better approach and a much more effective approach for these models. So we have to avoid the risk of assumptive research, thinking that we know what the problem is and developing new evidence that that old model is working. We need housing first in Belgium. It is a very important one, but we also have to pay attention for how the target group is changing and what kind of new interventions we need. This is the first important issue there, I think. A second one, if we want to make use of realist evaluation, or what's the added value of the realist evaluation approach, like implementation research, it says we have to pay attention to actors and their beliefs, practitioners, organizations, stakeholders. We have to focus on mechanisms, and not only how to do it, but also what is the underlying theory of change, how does it work, what makes it work. And the discussion has not only to be about what do I do, but also why am I doing this and why is this leading to this kind of results. And this is a much more difficult question to answer. And it's all about context. It's taking into account the context, the changing context of the target group, but also the policy context. I think if even a federal or a Flemish agreement by the government is not clear about housing first, then it becomes very difficult to scale up housing first throughout Flanders and Belgium. And then, thirdly, if you want to do implementation research, and I make use of this table by Bennett and others, you will see that the research agenda has a lot of other research questions. Bennett and others introduce appropriateness, fidelity, acceptability, intention to adopt, coverage, feasibility, implementation costs, and sustainability as the guiding criteria of implementation research. What's implementation research about? It's about asking how appropriate and effective is the intervention. How well does it fit with the context and the actors? You see the realist evaluation approach. To what extent is housing first or other models appropriate in the context? Fidelity. Do we stick to the model? Do we stick to the decoupling or not? If you want to study housing first in Belgium, let's see whether these projects stick to the model. Acceptability. Do the stakeholders accept the model? Like I mentioned earlier, for instance, in Antwerp, they are not really convinced that housing first is the best solution for homelessness. The intention to adopt. Are they really want to do it or not? A lot of saying we want to do housing first, but how strong is their intention to adopt? Who is covered by the intervention? Is the intervention feasible? What does it cost? And we need more research into costs in these kind of social work programs and social interventions. I have shown quite convincing evidence that doing new things is much more cheaper than doing the old things, and that doing new things is even more cheaper than doing nothing. And it seems very strange to believe, but that's the case with a lot of different programs. Because if you don't do anything, it will cost more for governments. So paying attention to implementation costs. And the last one, of course, is sustainability. Can we sustain this intervention? So, coming to a conclusion, if you want to do implementation research, then you have a totally different research agenda compared to the traditional agenda on what works, does it work or not. All these questions are very relevant and interesting research questions to take up in practice-oriented research to scale up interventions. So at the end, I want to thank the Prof Chair to give me the opportunity to share with all of you this my insights on implementation research. And maybe there are some questions you want to ask on that. Remarks? things you totally don't agree with. As you're all actors and stakeholders in the field, it's very interesting to hear what you think about them. No further questions? Okay, then I want to thank all of you to be present here today, and you can make use of the opportunity to watch all our webinars on YouTube. We have a next one coming up on the 15th of November. It's called We Decide Optimized. It's a totally different theme, namely advanced care planning, but it's the same paradigm which we are using. It's about implementation research. It's not about answering the question, does it work? But it's answering the question, what do we need to make it work? And this is a much more relevant question from my perspective to take up. So we invite you to be well to follow these webinars, and you can go to our website, www.kuleuven.be, Lucas, which you find on which you find all the details of the other seminars. Thank you very much.